Hi, Dr. Milky back with another message about plantar fasciitis. I had a patient come into the office recently who had pain in her ankle, mostly on the outside of the ankle and a little bit on the inside of the ankle. She had seen a podiatrist, maybe about 18 months ago, and she was given a cortisone shot, which helped a little bit, but she continued to have pain. So she decided to see an orthopedic doctor and kind of the same scenario, no real diagnosis other than like your foot hurts and maybe a little bit of tendonitis. So he gave her a cortisone shot, which really didn't work. And then a decent amount of time passed. And I see that a lot. People don't get relief from seeing a doctor or two and then just kind of stop and maybe a little bit hopeless. But, something triggered her to want to see another doctor. So she was referred to me and he did an assessment and took an x-ray and couldn't find anything bad there, but certainly her foot didn't look right. The position wasn't right on the one side. You always compare it to the other side. So I said to her, has anybody ordered an MRI? And she said no. And I said, well, we need to find out what the diagnosis is. I don't know it yet. They certainly didn't give you one, so we need to get that. And an MRI is a great piece of technology that can do that. And lo and behold, we did an MRI and we found out what was wrong. And, now we can put a plan together to get her better. How does this apply to plantar fasciitis? I see this all the time. People come in and they have pain in their heel and they've had it for a long time. And maybe they've seen a doctor or two, or maybe no one. And the thought is that this is plantar fasciitis. And in reality, it's not. It's something else. There's several other things that it could be, and it can mimic plantar fasciitis pain. So stretching and ice and physical therapy and better shoes and inserts and anti-inflammatories and rest and all the things that we do for what we think is one diagnosis aren't actually going to work because it's not the right diagnosis. So the right diagnosis is absolutely essential at the outset of all this. Without that, we're just basically, like throwing darts in the dark. And, we're not going to hit any target because we don't know what we're shooting at. So we have to shoot at the right thing. I hope that helps. And again, feel free to pass this along to anybody who might find this worthy for them. And I'll see you next time.